Good morning, everyone. Welcome to day 2 of our 2021 E.R. Brown Symposium, Opening Doors for All, Improving Health in Housing and Homelessness. Thank you so much for joining us. For those of you where this is day 2, thank you for staying with us in these conversations. And for those of you who are just joining us, I'll try to recap and get you up to speed of what we covered yesterday. I'm Ninez Ponce, and I'm the director of the UCLA Center for Health Policy Research and professor in health policy and management at the Fielding School of Public Health. We are so delighted that you could join us today. Why is a Health Policy Research Center hosting these convenings and conversations on housing? Well, as one of our panelists said yesterday, Margot Kuschel from UCSF, that there is nothing more powerful in medicine as housing. So I wish to thank Margot and to all of our esteemed panelists yesterday and all of our discussants, our sponsors and planning committee members and staff who are actually all around here. You can't see them, but who have been really marvelous in setting up this meeting. And each of you for participating in the E.R. Brown Symposium. So yesterday was day 1. We had 2 panels and welcomed 2 current public officials and 1 former public official that invested in affordable housing during his tenure in Nashville about 20 years ago. We heard about lessons learned and experiences from Boston, from Houston, from Nashville, from Oakland, and right here in Los Angeles in Skid Row. We gleaned perspectives from the veteran perspective, the LGBTQ communities, and Black women. We heard an appeal for lived experience, for authenticity, and the primacy of elevating the political voice of the unhoused. We closed yesterday's session with a better understanding, I hope, of the pain of deeply ingrained racism that continues to trap many people today. We must also tailor programs to the individual. As Dana White from True Colors noted, we are trapping many people between a rock and a hard place. Yet, let's not continue tokenism. Let's not continue white saviorism. So the candor and the level of expertise and commitment demonstrated by all of our speakers yesterday was remarkable. As Mayor Schaaf of Oakland noted, the plight of the unhoused is a reflection of the soul-crushing failure of all of us as a society. To solve this complex and grave societal challenge, we must go outside of our traditional lanes, and that's what we hope to do in this symposium today as a start. Whether as government officials at every level, federal, state, cities, counties, and cities, whether we're researchers, and again, this call to action to not just stick with the policies, but also an implementation. Whether we're nonprofit leaders, philanthropy, we heard from Houston that without a state, local safety net, that philanthropy stepped in, private money stepped in. And as Eva Thibodeau said, love HUD. So it will take all of us to solve this. And while we must all partner and engage, we also must dig deeper. We need to listen deeply to an array of voices, a wide array of voices, and listen with humility. And we must resist the temptation to hamper effective policy with well-intentioned yet harmful constraints. As Mayor Schaaf noted, a new coined term, tweezerism. We need to look at the forest and not look at just the minutia of different boxes in trying to solve this problem. We learned about recently enacted state investments that will help California cities and towns develop long-term housing strategies and meet some of the enormous demand and need that we have. We also touched upon the need for more housing supply and tensions in communities that have slowed the progress. In short, our panelists gave us much to digest yesterday. Today, we hope to continue the journey with a focus on policy solutions moving forward. I invite you, as Suzette Shaw said in her closing, to imagine what could happen if those with lived experiences informed, led policymaking decisions. Imagine a housing for all being considered a human right, not an entitlement. So those are some of my thoughts. I welcome you to share what stood out for you. Please share in chat and to engage with our community here, our Zoom community here for the day. As we begin our second exciting day of the E.R. Brown Symposium. Again, I hope Marianne Brown is here. This is to honor Rick, the founder of the UCLA Center for Health Policy Research, who has guided a lot of us in our thinking on not just health for all, but all the opportunities of health for all. And today we're going to talk about housing. Thank you for being with us. So hoping the chat, yay, Marianne, you're on. Thank you. So I believe our keynote is here, Donald Whitehead Jr. Our keynote speaker today joins us from the National Coalition for the Homeless. Executive Director Donald Whitehead Jr. works to elevate the voices of those experiencing homelessness so that our country can address the intersection of racial justice and housing justice. As someone who has experienced homelessness himself, we are grateful to have his voice to add to our conversation and his expertise. Donald, thank you for being here. You have the room.
Good morning. I am grateful. Thank you so much for the introduction. Very happy to be with you today in sunny California. And thank you so much for putting this together, this symposium to talk about an issue that is very near and dear to my heart. I am the executive director of the National Coalition for the Homeless. The National Coalition for the Homeless is the oldest organization that works exclusively with and on behalf of people experiencing homelessness. NCH has been around since the late 70s, and NCH is principally responsible for the creation of the McKinney-Vento Act. That legislation was written in our offices and made its way to Congress and finally got enacted in the late 80s. That's where I want to start today. I want to frame in my time where we are today in the issue of homelessness. We have had four distinct periods of homelessness in our history in this country, from starting in colonial times when people were struggling with displacement for a number of different reasons. Some of it, some of the racial challenges that we had around Native Americans in this country and them being displaced. There were also displaced settlers because of the skirmishes. Most of the resources at that time were only for people who were not people of color. But since that time, we've had several other periods. Each of those periods was followed by some sort of intervention by the federal government. But since 1978, since 1987, with the enactment of the McKinney-Vento Act, there has not been a comprehensive federal response to homelessness. And so in that time, we've seen homelessness grow at a rate that is unprecedented. And this is actually the longest period of time without that federal investment. Now, I'm happy to say that we have seen enormous resources coming as a result of a new administration who does seem to have a focus on homelessness, and also because of the issues related to COVID-19. The epidemic has really taken its toll on people at the bottom of the economic ladder, especially those that are Black and brown in this country. But we have seen a robust federal response, and even more is actually on the table in the infrastructure package. However, as we hear about that being reduced, of course, the first things that are being negotiated down are the millions of dollars, billions of dollars, in fact, that are targeted to programs to help people that experience homelessness. And so even with the robust work being done by the current administration, it's still not enough. This is an issue that we have failed to ever really approach in a way that addresses the underlying structural deficiencies in our system. We haven't seen any policy or program that addresses structural racism or the lack of affordable housing. We believe we have launched a campaign at the National Coalition, and we're inviting partners from around the country to be involved in our campaign to address that. What we've launched is the Bring America Home Now campaign. And you probably have heard about other campaigns that are underway to address structural issues, but none like this. And kind of the unique aspect of this is that it's being led by people like myself, people who have the lived experience of homelessness. My homelessness happened quite a while ago. But it is in fact a part of my life. It actually happened twice in my life. Today, I'm dedicated to ensuring that people with lived experience are involved in every aspect of homeless services. Working really hard with HUD, we've created a lived experience technical assistance component of our work to train people with lived experience on how to become parts of boards and how to become part of the solution to homelessness. And again, we've launched a campaign. It's the Bring America Home Now campaign. Our campaign is a campaign that doesn't look at myopic solutions. Part of the problem we have is that we keep entering into this vicious cycle that doesn't get to the underlying issues and only has resources for small portions of the population. And we have segmented those populations into the deserving and non-deserving poor. We want to lift all boats. We want to lift the tide so all boats are included in the solutions. The Bring America Home campaign has 6 policy components. It has housing. As you've heard before, we believe that housing should be a basic human right in this country. We believe that health and homelessness are inextricably linked. In health and homelessness, people should have safe, stable, affordable housing as a prerequisite to health and well-being. One area with little or no attention in policy over the last several years has been the area of livable incomes. We have not seen in our federal policy and attention. In fact, the Department of Labor has one program targeting homeless people, and that program is a program that's only reserved for veterans. Again, the deserving versus the non-deserving poor. We think that that is a tragedy in the United States of America. The Department of Labor, responsible for creating jobs and training, should be able to do that for people experiencing homelessness. We also believe that livable income should be a part of any discussion about ending homelessness, and that people that are disabled or on Social Security should have a limit that actually allows them to pay for housing in this country. We know right now that there's nowhere in this country that at a minimum wage you can actually afford housing, and that has to change. If you're looking for a 2-bedroom, you can't do that at minimum wage anywhere in the entire United States of America. And very few places you can even do it with a 1-bedroom. In California, the housing wage is about $46 an hour. We also think it's so important that we increase the levels of education in this country as a part of a solution to homelessness. Not only the education for homeless children and youth, we know that youth that are involved in any of our systems, the foster care system, the criminal justice system, the homeless system, tend to become homeless as adults. And we need to change that. We also need to create training programs that are targeting homeless individuals in this country. And we also think that we should absolutely address both civil rights. The criminalization of homelessness is a tragedy in the United States. We have cities that are banning and attacking encampments One, it's a public health issue. The CDC says that if you move people around in encampments, it really has a negative impact on the COVID epidemic. However, cities are choosing to do that anyway. We think that that should be something that should not be legal in the United States of America. And finally, we want to focus on anti-racism. And we don't want to just talk about structural racism as an issue within the homeless population. We know that in this country, although African Americans make up 13% of the population, they make up 40% or higher in some communities of the homeless population. And if you look at poverty, poverty is not the indicator, as some would think. The issue of poverty and people of color, actually, the trend goes upward. So more people less people in poverty, more people in homelessness. When you look at white individuals, it actually goes down, and that would be the same for Asian individuals. Native Americans, it's about a 6-to-1 ratio. We're kind of still, the jury's still out on where we are within the Latinx Hispanic population, and there's a number of reasons why. In some communities, it's 3-to-1. In other communities, it's about even. We have to understand why that is. We do have some thoughts about why that is, but we do believe that in the richest country in the history of the world, we should not have growing homelessness. Over the last 5 years, while we've seen numbers in some of the subpopulations that get the most attention go down, as you know, in California, the numbers of people living outside in the richest country in the world continues to grow. And we believe that that should not be possible. So we're asking you to join us. Part of organizing this campaign is more and more individuals and grassroots organizers and politicians. We want everybody to be a part of this campaign. We think that if we can drum up the grassroots advocacy around this country and make homelessness an issue that's important. It was important in California in the recall election. We want to make it that important in the rest of the United States. And we want to solve this problem. It's a solvable problem. We can do it. We just need the will. We just need to, as Martin Luther King said in one of his last speeches, what we need to do is make sure that we are not satisfied with people living on the streets and in a place where there's a separation between wealth and income and low-income people in America. So if you'd like to take a look at our campaign, please either go to our website, National Coalition, www.nationalcoalition.org, or go to the Bring America Home Now website at www.bringamericahomenow.org. That's how you can get in touch with us on the campaign. And I do thank you for being here. I think that is my time. I am very grateful for UCLA for inviting me today. And I hope you'll join us in this campaign. We've done this a couple of times in history. We did it through the Housing Now March. We got a lot of new programs, and we're hoping that we can do it again. We can end homelessness, but we have to be committed to ending it and ending it for everybody and ending it now. I thank you very much and have a wonderful day.
Thank you so much, Mr. Whitehead. That was very succinct. It was a call to action. It was specific solutions that we had grappled with and talked about yesterday. Are you available for questions? Just curious.
I'm absolutely open to questions for as long as you need.
Okay, because we're ahead of schedule.
Right.
So,
I think I started a little earlier. I thought I wasn't starting until 12:45, and I was surprised when you told me to start. So I'm happy to stay as long as need be.
Okay, so I think we have one question, and please start going to the Q&A function, audience. Doing a lot of outreach in our city here in California, it is found that many homeless came here from being homeless in other states. Do you find that to be true in your evaluations?
Oh, statistically, that is actually not true in most places. So what we have found through research is that people experiencing homelessness experience it most likely in the community that they either grew up in or they've lived in for some time. So the idea that people move from place to place as a result of their homelessness to find better services or whatever the case may be is not something that is typical for the homeless population in most communities. Now, we have seen in previous times this idea that homeless people are given one-way bus tickets from some communities. Now, this happens a lot around major events like the conventions, both Democrat and Republican conventions we've seen this practice. The Olympics was another time when people were given one-way bus tickets out of town. So that does happen, but more often than not, people are homeless in the community that they were homeless in that they lived in before they became homeless.
Thank you. And I wanted to get some clarification on some of the stats that you talked about where poverty is not the indicator and the focus on anti-racism policies. This was also the call of action from several panelists yesterday, including Mayor Libby Schaaf, an appeal to us researchers to think of anti-racist way of thinking in terms of crafting research and policies and implementation. So when you said the ratios, can you explain that a little bit more, the 6-to-1 ratio? And also, and I'm curious about the Latinx community, if that was also a variation on how welcoming, say, a society is to immigrants. Why you saw some variation?
So there's a couple of things in all of that information. We do find that the highest disproportionality is with the Native American population. So while they make up a very, very small portion of most communities, they tend to have 6 times as many people by percentage are represented within the homeless population than in the general population. And the same thing for African Americans. Now, the jury's out again on the Latinx population for, cultural reasons, for sometimes other issues like documentation. People don't make it into services. And it actually has an age component to it. So in places like Massachusetts, for instance, the number of people in the Latinx population that are parents of children and youth it's actually higher in that particular community. And so there are sprinkled within communities, there's an overrepresentation of the Latinx population. But none of those populations, you would think that the poverty line and the homeless line would be on the same level. But when it comes to the white population, the Asian population, it goes way down. So there's a level of people in poverty, the number of homeless people goes down, but with Native Americans, African American, it goes dramatically higher. So poverty isn't the top indicator.
Small marker, yeah.
Yes.
Yeah, thank you. So there's some questions on Q&A. The 952 one is, why do you think California has such a growing homeless population compared to other states in the country?
So I noted the statistic about how much it costs to actually afford housing in California. So it's one of the highest. I think Hawaii may be higher, but it's one of the highest housing costs anywhere in the United States. So at the same time, you have that really high housing cost. We have a minimum wage that hasn't changed in decades. And so people are not able to afford housing without 2 incomes or without being able to work a second job. And so people find themselves, sometimes it's natural disasters, sometimes it's illness, COVID. One of the reasons COVID has dramatically increased the people at risk of being homeless is that it's taken one of the breadwinners out of the household. Because if you have children at home and they're homeschooling, someone has to supervise those children. Someone has to help them through their lesson plan. And so for families that were struggling and needed those 2 incomes, they now have 1 income. That is part of the reason. There's all kinds of other reasons that we have to address structurally. Zoning laws, as you know, are a big issue in California. A lot of communities aren't open to multifamily housing, and we have a shortage of affordable housing in this country. And the only place where it's really dramatic is at the bottom of the economic ladder. Builders aren't building housing that's affordable to people who work in jobs that don't pay considerable amounts, jobs that are at entry level or jobs that are in the service industry. People have those jobs, but they're not able to be able to afford housing at those wages. So we have to increase wages. We have to build more affordable housing. We've pressed for instance, the Section 8 program to become an entitlement program, that if you qualify, because we see waiting lists in places like Los Angeles County of years. So it takes you years to just get on a waiting list for subsidized housing, although you qualify for it. So we have to dramatically increase housing production in this country.
Yeah, I think that was raised, not just for 23 people, but really to have it to scale, with tens of thousands of people. There are three more comments. One was from the 958 comment that California is a generous state on this, and people all over states may come here even for services, supportive services for substance abuse and addiction recovery. So that was one added comment on why California, how does it compare? The 955 comment is there's often pushback from residents and around increasing availability of housing at all, so let alone affordable housing or housing for the homeless populations. Do you have thoughts about building political will among communities? And you're building this movement, so thoughts about that so that communities can be more supportive of these efforts. I mean, we heard a lot about the NIMBYism too. That's a big obstructor of local.
And NIMBYism is a big obstructor. And part of the reason why we're in this situation, we know that deinstitutionalization is a big part of the numbers of homeless people we're seeing, especially the chronic street homeless population. Many of those people should be in some sort of facility that provides them services. But when deinstitutionalization happened, there was this promise that we would build community-based small mental health service program because we didn't want to institutionalize people in warehouse situations. We were going to do that in the community. However, because of NIMBYism, none of that got built. We see the same thing happening all over again when it comes to the placement of housing through the homeless service sector and also just affordable housing in general. NIMBYism is a big issue. So we have to build the political will. And part of that is putting people that have experienced homelessness in places where people can see that they're not the stereotypical person that they see on the ad every Thanksgiving from one of the major service agencies, that they're people just like you. They're people like Tyler Perry, or they're people like all kinds of people, Jewel. Those are some names of people, Tiffany Haddish. These are people who've experienced homelessness, but gone on to some really, really great things in their lives. Cory Bush, a current representative out of St. Louis, was once a homeless mother with her children on the streets of St. Louis, and now she's actually working on legislation in Congress. So we're trying to change the story, change the face, present people as they are after this experience, because it is just an experience. You get labeled a homeless person, but it's really not who you are as a person. It's the experience that you've gone through, and people go through it, and they're not all on TV and they're not all on billboards, but really successful people have come through this experience. And so we're building the movement around showing people that these people, they could live right next door to you and it'd be just like any other neighbor you have. So there's no need to fear people. There's no need to criminalize people, because they are in fact people, and they're people that deserve kindness and compassion just like anybody else.
Thank you. Yes, it was raised as it's a moral imperative.
Yes.
It's not about the condition, it's the humanity that we have to think this through. So I wanted to thank you, Mr. Whitehead, for the inspirational, informative way forward talk. We actually are going to end our session today with Assembly Member Isaac Bryan, who is a new leader in our assembly, who has lived experience and who I think will be an example of the face moving forward of all the decision makers in solving this problem. I'm also heartened that you say it's a solvable problem. Thank you so much. Audience and speakers, I have to move on to the next segment of our program today. Again, a big thank you to Donald Whitehead. I know you're very busy and you have a lot of influence and reach, and I'm glad let it continue to happen, and we will join your social movements.
Thank you so much. You guys have a wonderful day.
Yeah, thank you. Thank you. We're going to move on to the panel on policy levers for California to mitigate homelessness. So Mr. Whitehead's talk is really tease up the next conversation. We're going to move to this forward-looking panel. We're excited to have Randall Kuhn, Lipi Shimkata, Nadare Parat, and Gary Painter join us. Their bios will be posted in the chat, but I wanted to briefly introduce our moderator and discussant, my colleague, Dr. Randall Kuhn. I'm in so many school committees with him, and so honored that he's actually here moderating this panel on an issue, a public health issue that he cares so deeply about. Dr. Kuhn is an associate professor in the Department of Community Health Sciences at the UCLA Fielding School of Public Health. Thank you, Randall, for leading this conversation.
Hello, everybody. Is my audio okay? Yes, hopefully. Good.
Actually on my end, but let me. I'll turn off my video.
Okay. Hopefully, I realize, am I supposed to turn on? We're having, Ninez knows we're having serious Wi-Fi issues in the public health school. So everything's, anyway, hopefully it'll be great. It's very nice to be teaching classes in person, and I hope that forums like this will one day very soon be in person. So I just wanted to, just introduce briefly how excited I am about this panel. I think it's instructive of how complex the homeless services and policy ecosystem is, that I know all three of our speakers, but in completely different contexts. And that really, I think, shows that there is no one thing of homelessness services, at least in terms of the types of policies that need to happen. And
right, Randall, you're a bit Randall, you're a bit patchy. Randall, really? Maybe you can turn off your camera.
Oh, sure. I don't know if that will help.
Thank you.
Here, I think maybe I should turn off my Wi-Fi. Sorry, I should have done that before. Hold on. Let's see if this helps. Is that better? Oh.
No, I think, Randall, it might just be me, because we're seeing in chat, they hear you fine. Okay. So, okay, you can come back on.
Okay. So, right, all I was going to say is we've had a lot of really interesting and important case studies. And, as we teach in evaluation classes, no case study is directly translatable, but we learn something from all those case studies. But just in terms of a starting point for the difference between, say, the case studies that we heard about and Los Angeles, you can think about any kind of trope about Los Angeles being ungovernable or being a very complex place. And that's really the challenge we have in Los Angeles and in California, is we have an incredibly complex problem in itself, right? Homelessness exists at the interface of housing policy and supply, poverty, health, structural racism. And then those systems in Los Angeles County and in California are both stretched and fragmented, to say the least. And so I think it's actually a really good time just to kind of take a deep breath, because we're going to take a deep dive here. And what I would hope to come out of this panel, each speaker is going to have 7 minutes, is just to give people a roadmap for what the systems are, how they function, what are some major changes that are about to come, and kind of how health policy fits into this broader system. And so our first speaker will be Gary Painter, director of the Saul Price Center for Social Innovation at USC, and the context in which I know him, director of the Homeless Policy Research Institute, also based at USC. Gary, take it away.
Thank you, Randall. And I just wanted to appreciate everybody for, especially my colleagues over at UCLA, for putting this together. And, I think today's kind of previous speaker, Mr. Whitehead, did a great job of really teeing off our conversation. In many ways, you're going to hear a lot of points of emphasis repeatedly from myself and others. And the other thing I just want to note is that I'm going to focus a little bit less on some of the health factors that might put people at higher risk of becoming homeless, and speak about some other issues. It's also worth reflecting on kind of where we've been and how the policy environment has shifted as we have gotten more and better data over the last decade. So part of getting that more and better data was the fact that we had more precise measurement of how many people were experiencing homelessness on the streets, in their cars, or in interim housing. And what that did is it led to a movement, really a political movement, that led to the passage of Measure H in the county and Measure Triple H in the city. And in large part, the focus of those particular bills was to make sure that we had enough housing and enough services to support that housing for the chronically homeless population, as HUD defines people who have been homeless more than a year or more and have more than a single risk factor associated with being homeless. And so that set of policy initiatives was focused on taking the roughly 15,000 folks who fit into that category and provide them with the permanent supportive housing that they needed. It's not always clear from policy dialogues and what people think. People may have thought that those measures were intended to solve homelessness, to end homelessness themselves, but rather they were really focused on that particular piece of the population. What we know, and this is what it really is frightening to everyone, is that throughout the years since the passage of those bills, and of course we haven't yet built all the housing associated with what has been put forward, and the pandemic actually slowed that down to some extent, just because early on we slowed down all construction, is that we have seen more people becoming homeless than people who are being housed. And the latest numbers were from 2020, and that's a part of our challenge, especially in the research community and the homeless service community, is that we don't know exactly what's happened since the pandemic on a lot of dimensions. But roughly, those data suggested that 20 more people were becoming homeless each day than were being housed, and over 200 people were being housed. With that in mind, and then the pandemic that hit, there have been, lots of resources that have come to bear. But as Randall hinted at, there's a lot of intersections that make it difficult to know whether we ought to have imagined that all of those resources would reduce the number of people experiencing homelessness or increase the number of people experiencing homelessness. So principal among those resources, and some of the other panels will talk about that, are projects Room Key and Home Key, which allowed us to use hotel and motel resources to keep our unhoused neighbors in ways that we weren't doing before. We're able to do it in a much more, what I would say, kind of crisis motivated way. And that ended up housing thousands of people. We also saw a policy environment that included an eviction moratorium. That eviction moratorium prevented inflow for people who for economic reasons could not remain housed. And what we know from the data, again, from 2020 and before, is that there had been an increasing number of people becoming homeless for the first time simply because of economic reasons. For single adults, that had risen all the way to 59% of people citing these economic reasons, and for families, it had risen all the way up to 71%. And so the fact that people could not be kicked out of their home, would also likely lower the number of people experiencing homelessness. But on the countervailing side, the pandemic also created situations where a lot of people that were doubled up may not have been as welcome with the people that were hosting them. And we know that actually people are most likely to become homeless after having become doubled up, especially for the first time. And so that could have potentially increased the number of people experiencing homelessness. It was also mentioned by Randall that, and also Mr. Whitehead, that there's this deinstitutionalization that happened with COVID. People were let out of jails to reduce congregation there. And that actually, without policies to connect all of those folks to housing, could have increased homelessness. So where are we right now with the policy environment? Well, clearly there's enough people experiencing homelessness in tents and so forth, in encampments, that we have started to see more dramatic action from courts in terms of Judge Carter. Many of you in the region have heard of his rulings about really addressing immediately encampments that existed under freeways and existed at Skid Row, recognizing this is not a humane way to live and that we ought to do something about it immediately. We have seen at the same time that our community members have grown impatient. The fact that there are lots of public spaces that are now unsafe for the community, not just for our unhoused neighbors, but for others. And so you've seen actions taken at Echo Park, at Venice. You've seen the City Council of LA pass an ordinance. Its number is 4118, which says where encampments can't exist and where city public safety and sanitation almost has the impetus to take action. With that in mind, it could lead to all sorts of challenges with respect to criminalization of homeless neighbors, and we know that that doesn't work. At the same time, there are these additional resources. With Home Key getting authorized for billions of dollars over the next few years, we have a set of emergency vouchers that are being deployed. I think what we need to do then is to take those resources, target them to address some of the disproportionality that exists because of structural racism that Mr. Whitehead noted, and use those resources to make sure that we're reducing disproportionality in the near term. I think these resources have also shown that with more support as it relates to housing, whether we can get to an entitlement voucher or not, the state of California can think much more clearly about renters' tax credits that can support people who are currently paying more than half their income as rent. And we know from the data that actually is more than 1.2 million Californians who are paying more than half their income as rent. So there's some things we can do immediately. With that, I'll pause, and then we can certainly return back to these issues in Q&A.
Thank you so much, Gary. That's a really helpful introduction. And next we move to Nader Purat, who is Associate Director at the Center for Health Policy Research, Director of the Health Economics and Evaluation Program, and she will talk about her evaluation of the Whole Person Care Program. Nadi.
Thank you, Randall. And good morning to everyone. During the symposium, we have talked about many of the factors that have led to homelessness. We've heard some solutions and suggestions for housing those experiencing homelessness. I'm going to actually focus specifically at the intersection of homelessness and health. And wanted to say, we have collectively acknowledged that many socioeconomic and environmental factors determine the health of an individual or the community, and we call these social determinants of health. In fact, existing evidence shows that only 20% of good or poor health status for a person can be traced to access to and quality of healthcare. The rest of it depends on other factors, and a major social determinant is housing or lack of. And I think it is worthwhile to review the links between homelessness and health briefly. Those experiencing homelessness lack basic necessities such as food and shelter. Those are critical factors for maintaining and improving health. Homelessness is associated with physical and behavioral health conditions such as depression, anxiety, and substance use disorders. It is also associated with experiences of trauma and violence, all of which lead to increased mortality. Those experiencing homelessness frequently cycle through jail, rehab and detox, shelters, emergency departments, hospitals, and the street. Therefore, providing healthcare doesn't necessarily lead to improved health outcomes because lack of housing reduces the ability to prioritize health when sick and reduces the effectiveness of medical interventions for reasons such as inability to recuperate in safety or store medications. Evidence shows that housing interventions improve health and reduce healthcare costs. Evidence also shows that housing has led to lower Medicaid expenditures because it reduces the need for avoidable hospitalizations and emergency department visits. Acknowledging the importance of housing and health, California has embarked on 2 different demonstration programs in the past few years to address the health of those experiencing homelessness. One of them is the Whole Person Care Program. For the last 6 years, California has embarked on this demonstration to provide needed services to Medi-Cal beneficiaries who, I quote, are high users of multiple systems of care, including emergency department and hospitals, and continue to have poor health outcomes. So Medicare beneficiaries who are at risk or experiencing homelessness are eligible for the program. And there are about 26 counties participating with 25 pilots. As the lead state evaluator of the Whole Person Care, I'd like to share some of the evaluation findings with you. Following the assumptions that high use of ED visits and hospitalizations is in part due to challenges of navigating complexities of the healthcare delivery system, because there are silos between medical care, behavioral health care, and social service providers, Whole Person Care provides care coordination so that enrollees can receive needed services instead of visiting the ED for non-urgent care or going to the hospital for lack of any care. Pilots are highly encouraged to provide housing support services that are defined as assistance in accessing and obtaining sustainable housing solutions. So provision of housing support services differed by pilots, but included things like tenancy support, which is counseling and training individuals to move or remain in housing, completing applications, contracting with partners with expertise and resources in providing housing or mental and substance use care and life skills and vocational training, providing non-rent funds to assist with housing-related needs, and legal support and coaching services for successful and secure housing. Pilots use different approaches, including specialized housing staff and care coordination teams, such as navigators and specialists in housing, staff with lived experience who are critical to building trust and rapport with enrollees, and direct referrals to community-based housing organizations. As of 2020, Whole Person Care had enrolled 106,775 enrollees experiencing homelessness, and a lot of them were in LA County, followed by San Francisco and Orange County. Interim evaluation findings showed that 92% were younger than age 65, 56% were male, 35% had depression, 31% had anxiety, 25% had psychotic disorders, 30% had drug, and 20% had alcohol use disorders. Pilot used a lot of diverse strategies, such as sending teams to shelters, food kitchens, churches, under bridges and freeways, and placing housing specialists at shelters, providing basic necessities such as food, shower, and clean clothes to engage eligible persons. Pilots reported successes, such as 72% of those referred for housing Among those pilots that focused on homelessness to have received those services, 99% of those that at the start were housed at the beginning, remained housed after 6 months, which was a measure of permanently housed. And then everyone talked about the lack of affordable housing as the most significant challenge facing their efforts. Further information on the impact of the program on utilization and the related costs are forthcoming in our final evaluation sometime in 2022. A second program is the Health Home Program California has implemented. This one focuses on complex medical needs and chronic conditions individuals who may benefit from enhanced care management and coordination, including, again, those experiencing homelessness and requiring provision of housing transition services and housing and tenancy sustaining services. As of September 2022, Health Home Program has enrolled 4,000 such enrollees, and by September 2020, 68% have received housing services. I would like to talk about California's effort following these two demonstrations. California is using the lessons learned from both of these and taking a significant step forward with incorporating housing support services as a Medi-Cal benefit. The idea is, I quote, leveraging Medicaid as a tool to help address many of the complex challenges facing California's most vulnerable residents, such as homelessness. Under this new initiative called California Advancing and Innovating Medi-Cal, or commonly known as CalAIM, California is planning to add several specific services for those at risk or experiencing homelessness, including housing transition navigation, housing deposits, housing tenancy and sustaining services, short-term post-hospitalization housing, recuperative care for inpatient transitions, and day rehabilitation programs. By early 2020, all health home and whole person care enrollees experiencing homelessness would be transitioned to CalAIM, and the program will expand statewide. I will pause there. I was going to say a couple of words on Project Room Key, which evolved into Home Key, but I can hold on to those if there are questions.
Why don't you go ahead? Because I think it'll be important. It may be important for what Lipi was going to talk about.
Right. So Project Room Key, which you might have heard of, was established early in the COVID-19 pandemic to provide shelter to residents experiencing homelessness and recovering from COVID-19 at a place and providing them with a place to recuperate and quarantine, as well as also protecting others from getting infected. So in California counties, whole person care pilot resources were used to rapidly house program enrollees. And the success of the program has led to establishing Project Home Key Round 2. And this effort is administered by California Department of Housing and Community Development, with funding to develop housing, particularly to those experiencing homelessness and are inherently vulnerable to communicable diseases.
Thanks, Nani. And I'll just add, right, Project Home Key also involves, at least in theory and somewhat in practice in LA, the purchase of a lot of hotels and other unused large properties to quickly convert into housing, though there aren't that many of those compared to the overall inventory need. So with all of that, our next speaker, again, we're really just setting the stage here for what'll be a great conversation. Our next speaker, Lipi Shinkata, will tell us how the magic all happens at the ground level. Lipi's Director of Housing and Services with Housing for Health, which is an agency within the LA County Department of Health Services. So yes, Lipi, take it away.
Thank you so much. Thank you for having me this morning. This is really exciting to be able to really dig into all of this and really setting the stage for me, Nadi. Thank you. We, at the Department of Health Services at Housing for Health, we are probably the largest recipient of the whole person care dollars. And we've also got a health homes program, and we are heading headfirst into CalAIM. So all of it is sort of converging here, which is really exciting. But I'll take a step back and really tell you a little bit about the program and how we're implementing all of these funding sources for the community so we can use it in as the efficient way as we can. We were created in 2013, so we haven't been around too long. We're still sort of the new kid on the block doing housing and services. And we really had a charge of creating 10,000 units of housing really, really quickly. We didn't have actually a date in mind, but I think we've surpassed that as I start to talk about where our goals, what our outcomes are. We are also part of the group to end homelessness in LA County. So we do participate in the plans to end homelessness and work very closely with all of our system partners within the Department of Mental Health and also with the LA Homeless Services Authority. And of course, all of our public housing authorities. We couldn't do this work without them. We also are charged with reducing inappropriate usage of our healthcare system. As both of our speakers, Gary and Nadi, pointed out, that we have a lot of overutilization of our medical system for people who are just cycling in and out, and the cycle never really ends until housing is part of that solution. And we're also looking to improve our health outcomes for all of our clients over time. So we are essentially the high acuity service provider for the entire county of Los Angeles. What we really do is work on making sure that we have the services funding to match with any kind of housing that might be coming online. We can do that either through a project-based setting. So we do work a lot with developers who are creating permanent supportive housing, specifically dedicated to the homeless population so that there would be a site. It does take time. We can't really build our way out of this issue. So we also do work with our public housing authorities who also have access to subsidies. So the Section 8 program is a big program for us, as well as the continuum of care. We also use those subsidies. And we also did create our own subsidy program, a local subsidy called the Flexible Housing Subsidy Pool. And so with that, we're able to house additional people so that we can house people who may not qualify for a federal subsidy. We know we've got a lot of people who are either undocumented or wouldn't pass a background check with the HUD resources that we're able to get. So we really had to be as flexible as possible. One of the things that we are very proud of is being flexible, meeting clients where they're at. We're a very low barrier program because having any additional sort of rules and regulations to have people get in really is counterproductive. So being very, very client-centered is one of the things that we believe in, and we're also very much a harm reduction program. So being able to serve people and meet them where they're at is one of the things that we really take pride in. Why it matters to DHS is that public systems in LA County invest over $875 million every year. And I think that price tag has probably gone up recently. And a chronically homeless person can use up to $8,000 in public services each month. So we're really looking to reduce that cost, but also really to do the right thing and be as humane as possible to make sure that we're taking care of our most vulnerable neighbors so that we don't see people dying on the streets. Our continuum of services includes street-based engagement. So we do have at least 80 different street-based teams that are multidisciplinary in nature. So there are people with lived experience on the team, there are substance use providers, registered nurses, and sometimes also an MD that will join them and be able to provide services on the streets. We also have a pretty decent sized interim housing program where we have about 3,000 beds. We're really catering to a very high acuity population because they might need additional medical oversight and really be able to recuperate in a bed and have a lower level of care from an acute care setting. We also have permanent supportive housing, and that's the side that I manage. We've up till now housed about 14,000 people in permanent housing. We have about a 93% retention rate 1 year after housing. So, with the contracts that we provide in the community, those case managers are doing incredible work every day, making sure that people are getting into housing and really staying in housing. We also have a fairly large benefits advocacy program and also a sobering center. And I say all that because all of this really was funded through the Whole Person Care Program, through Measure H, as well as through the Department of Health Services. So we've really had a way to be able to braid all these funding sources to be able to provide the maximum number of services in the community and make it as easy as possible. So I'll talk a little bit about some of the funding that we have used and then what's coming down the pike so that we can continue to braid all these funding sources and really be as flexible as possible. With whole person care, that's really when we saw a huge expansion from when we were just doing DHS services. And so with whole person care, that was one of the ways we actually already had the infrastructure of Housing for Health and used whole person care funding to just overlay and grow that population even more. So being one of the largest whole person care programs, we were able to do what we call intensive case management services is really the housing supports that Nadi talked about earlier. We also did the tenancy support services, and we also had the benefits advocacy program that really was able to grow and be able to reach as many people as possible. Then on the heels of that, we were able to get Measure H passed, which was a really big feat for us. And it's really been a dedicated source of funding to be able to continue to grow our programs. And the permanent supportive housing side of the program really was able to benefit from that because we've never really had a dedicated funding source to be able to do supportive housing. And that's sort of the end game, right? That's the golden ticket for everybody to be able to get permanently housed and have the services wrapped around in that service setting. So we're able to really grow our program to be able to house people coming straight out of the coordinated entry system. Prior to that, we only served the people who are in the DHS hospitals. Now we're really, again, the high acuity arm for the entire county of Los Angeles. We're able to connect somebody with a housing voucher or a location where they can move to, have a case manager work with them all the way through that, and then be able to stay with them so that they can have the services and it's non-time limited. We also now are looking to add Measure J to our portfolio. And that's really the funding that started to happen last year as we start to move away from policing and try to put more funding into the community so we could have more community support programs. And so we'll be able to send that funding out to community groups as well. We also have a variety of state funding that we've been braiding with everything else that we've been doing. One of them is called the Housing and Disability Program, which comes from the State Department of Social Services. And so it comes through our Department of Social Services, but then comes to us to be able to provide funding for services for all of the people who are going through our Department of Public Social Services. So these are folks that are typically on general relief who are really only being able to get $221 a month. We want to increase their income and then also be able to get them into housing. And then we've also worked very closely with our HCD and also our recent, we are a recent recipient of the American Rescue Plan Act. So with ARPA, we are able to now provide additional 1,000 new slots for flexible housing subsidy pool. So with all of that, we're sort of building this massive plane and we continue to fly it, but we keep building parts of it as we keep going further and further and being able to serve more people. So with that, I'll close out and I'll definitely be available for more questions.
Thank you so much, Lipi. There's a lot there. And I have honestly so many questions that I think I'm actually going to start with the audience. I want to start with some of the audience questions in the Q&A. And one factual question, I think this is a good place to start, was on the question of in lieu of services. And I don't know if the, for some reason I can't find it now. Where did it go? This is from Erica Rogers. And these are open to all speakers. What are your thoughts on various health plans offering varying in lieu of services under CalAIM? Do you think this will make it harder to offer housing and supportive services to people experiencing homelessness under CalAIM? As someone who I totally don't understand public finance, I'm always fascinated by these kinds of questions. So
I can try to answer that, and Lipi and others feel free to join. In lieu of services under CalAIM is again a demonstration program. So under whole person care, there were two services. One was sobering center and one was recuperative care that was covered as a benefit, but then it was also optional. So now under CalAIM, these additional benefits are added because they were perceived to be important, but it's still a demonstration, so it is remaining optional. I am not quite sure why in lieu of services should have a negative impact, or whether implementation by health plans should have a differential impact. Maybe Lipi, you have any insights onto that?
Sure. I'm knee deep in it right now. We are working with the health plans to operationalize in lieu of services on January 1st, working with them to figure out which parts that they want to opt into. Right now, we do know that at least with a few of our local MCPs that they will be opting into recuperative care, housing tenancy support services, and housing navigation. So that really shouldn't be a disruption to any of the work that we do now, because those are all the same programs that we're running under whole person care. So we should be okay there. And we'll have to operationalize all of it and grandfather everybody in by January 1st. So we're headed to a very, very busy fall and winter getting all of that done.
Terrific. Thank you both. I'll jump in with a question. I think one of the controversial elements of CalAIM, again, there may be many, and maybe you all can share what you see as the most controversial, but certainly one of them is that it doesn't cover rent past the 3 months, and that realistically, given that we're in need of market-based solutions and prices are so high, is it really realistic to think that move-in costs, navigation, health services costs, and 3 months rent for certain populations are enough, or do we need a much bigger subsidy? And I guess if not, where will the funds to keep people housed long-term come from?
I can offer some thoughts outside of the specifics of CalAIM, but I think this gets to the broader issue of what are driving people to be, or increasing the number of people becoming homeless, especially first-time homelessness. And I think everybody has a good sense of that from this conference, that housing costs are a real driver. And the fact that people's incomes are not going up as fast as housing costs is a real driver. And as I mentioned in my comments before, if you have 1.2 million households paying more than half their income as rent, there's a lot of people who have very high, risk of housing instability, and a small number of those will become homeless. As Mr. Whitehead said, it's, even though that's a huge number of people, we still actually have a small percentage that actually become homeless out of those people. But unless we actually do something to address broadly housing insecurity, then we're not going to have any solution that's a 3-month, a 1 year like rapid rehousing, or even 2 years from rapid rehousing, a shallow subsidy, the flexible housing subsidy pool. All of those are time limited in one way or another. And what we actually need is a system of broader housing supports, and that could be in the form of, renters tax credits, or it could be in the form of, a Section 8 voucher. I like to say that one should imagine that people get something when they sign up for a housing choice voucher, and not just wait and get nothing. And what we know from the most recent research is that the number of people who are eligible versus who actually receive it has now grown from 1 in 4 to 1 in 5 nationwide. That's not tenable, and we should not expect people who are paying more than half their income as rent to be able to navigate, large expenses that they may face. The question was more about people who are currently experiencing homelessness, or who are almost experiencing homelessness. To that group, it's actually going to take more support than the broad support that I was referencing before. But I'll let my colleagues talk specifically about CalAIM itself and how to connect from CalAIM to other supports.
Well, I think you bring up a good point, Gary, and I would say really looking at prevention, because we can't build our way out of this, and there's certainly not enough units even in our own county, even if we got a huge infusion of Section 8s, which we actually did. We got emergency housing vouchers. We have 8,000 of them. And so now we're sitting in a place wondering, where will we use them all? Do we have the units to be able to use all of these amazing resources that we've just gotten? So I would also say we need to look at prevention in a far more upstream way. Right now, I think when we look at prevention, it's sitting at the homeless system of care. And by the time you do prevention here, it's really too late. And so how further upstream can you put it so that people don't even fall out to begin with? One of the things we are doing actually with California Policy Lab there at UCLA is a homeless prevention study to really see, looking at risk lists and calling people to see, are they going to fall out or not? Because if you can catch somebody a year before, you've already sort of stymied that, so we don't even have to deal with it on the back end, because we can't pull people out fast enough. It's just not sustainable.
I think, Randall, the big question you're posing is partly perhaps a jurisdictional issue or restrictions under Medicaid program on how money can be spent, which really points out the bigger problem is that because we have these silos, even at the highest level, in terms of what money is spent for what purposes, you're not necessarily able to do much more than what CalAIM is currently proposing. That is my guess. Of course, I'm not technically familiar with all of the nuances of what the state was able to do. Even under this, CalAIM is implemented under two specific waiver mechanisms. So the state is doing things that are outside of what Medicaid is usually allowing because it's a waiver.
Right. And of course, I guess there's a debate about how aggressive we can be with some of those waivers, but right. But that's politics, I suppose. And perhaps our next speaker, Isaac Bryan, will speak on that. Actually, a couple questions we had, I think, related to, I know, a major legislative focus of Assemblyman Bryan, which is on employment. So there were some questions about what role does employment play, how can we promote employment, and also a question about, essentially, should we be sacrificing location, proximity to amenities, in order, if, say, for people who are not likely to be working in the near future, should we be doing more to build, a lot more housing in places that are not necessarily that close to employment and opportunity? So maybe just thinking broadly, where does employment, workforce participation fit into the system, but also where does it fit into people's model for recovery and how someone can build towards a thriving life?
Well, I'll say a few things. One of it goes without saying that, if rents are going up but people's incomes are matching that, then we're not actually, the need for more affordable housing is not increasing. We don't have that. So we know that unless you earn enough to pay for the rents that you have to pay to be in the locations that you want to be in, then you're going to face housing insecurity at one point or another, or be at risk of facing that. So I guess it's almost like a question that's rhetorical. Of course, employment matters. People's incomes need to be higher to match, but it's just a piece of the puzzle. I think if we're thinking about sort of upstream in different ways, and also thinking about once someone becomes homeless, then there may be different kinds of employment interventions that are going to be most effective. For instance, in Los Angeles County, we know that 1/3 of people who are officially homeless live in their cars and RVs. We also know that group is, very much kind of economically homeless. They've recently lost their ability to stay in a place. Oftentimes they were doubled up. We also know that 20% of them work full-time. We also know that 80% of them work part-time or full-time, right? So I think one of the things to keep in mind is that people experiencing homelessness are doing so not necessarily completely disconnected from the labor market. In fact, they are connected, but they're connected to low-wage work work that is highly volatile, meaning that they may get a lot of hours one week or not very many hours the next. And so to that end, one pathway in terms of focusing our employment resources is to focus on people who are already connected, but can become better connected to the labor market, move toward living wage jobs more rapidly, maybe acquire skills that support that effort. But sometimes acquiring those new skills requires the ability to actually cut back hours in the short term, and you need support during that time. And so people often face, I'm working as many hours as I can just to stay stably housed. I have no ability to get into the educational investments that are necessary because I need every dollar I can earn in the short term. And so it might help us to think about people experiencing homelessness, that many of them are already connected to the labor market, but their connections are more precarious than they perhaps need to be. So that's one group that we should think very carefully about.
Nadi Lipi, what about in the target population for chronic homelessness programs, where employment rates, current levels of connection, as Gary points out, may be higher than we think in many cases, but are still quite low? What role does employment and workforce training play in there?
Yeah, I think it's really an important piece to anyone. We all find so much value in work and being able to be contributing to our own livelihoods. What we work on specifically first is really, we find people who are coming in at a very, very low sort of benefit level at $221 a month. We can step people up into hopefully some type of Social Security benefits if the disability supports that, right? And then we really look to see what else can you do. One of the programs we ran recently was an assistant case manager program to have people who are already living in permanent supportive housing, to see if people wanted to come back into the workforce to do case management and sort of give back in a way that they had been able to become stable and be housed for some number of years. But I do think one of the other components we're looking at more closely is having people move on and actually graduate and see if they could move into a different sort of, less supportive environment. And that might include some additional supports in a different way. It's not necessarily intensive case management services, but there should always be some type of safety net. And I do think work and employment, that's one of the things we haven't been able to reach just yet. I think we've been so busy just pulling people out of crisis that I do think that's a long-term focus for most programs. And I really think we should be able to look into that.
I could just add that we know that many of the pilots, the whole person care pilots, did mention providing those types of services, but we don't have specific information of how much focus or exactly what they are doing in employment, particularly when it's concerning people experiencing homelessness.
Yes, that's really good point. And on the issue of, I think Lipi's point about bringing more people into the homeless services workforce and ecosystem is just a really big deal. I know we hear constantly about the level of fatigue and turnover in caseworker population. We had a couple items in the Q&A about this, both with regard to general fatigue, but also specific fatigue relating to some of the new programs that are coming along. What's next? Benefits. What about, so there have been a variety of proposals for universal basic income, for enhanced SSI, SSDI, perhaps at the state level, in order to fill some of this gap. At the same time, we know that it's still a struggle to get that I think Lipi's team faces a daily struggle in just getting people enrolled on the benefits they are entitled to. But there's also a question about whether general assistance is really sustainable at the low levels it's at in California. What role do social safety nets play, particularly if we want to take prevention way upstream in the ways that Lipi described?
The Price Center team has actually done an analysis, and we'll be releasing it next month to talk about the social safety net and what a family who maybe has 2 kids of different ages, what they have available to them. And so you're right that in many cases people don't know what is available to them. The biggest thing that people don't know is the fact that there's a lot of benefits in the tax system now, and not from our kind of county social services agencies that are really, really important. And it's very possible that many frontline workers just have no idea about the tax system, tax credit benefits that support childcare. Although maybe with the current American Rescue Plan, with that child tax credit, it'll be in people's minds a little bit more. But what we also learned is if you don't get housing and childcare benefits, you don't come anywhere close to what you need to get by. And as long as that's the case, and that's going to be the case for kind of 2 reasons. One is you have to be extremely poor to qualify for the full set of childcare benefits attached to CalWORKS, which is our temporary assistance for needy family program here in California. So that means that some people who may only earn $20,000 a year may never qualify for that full set of benefits. So that's important. And we've already spoken to the issues around housing vouchers, that they're just simply, not supporting the people who are eligible for them. And so it's incredibly imperative to take action there. You could increase people's overall income through a universal basic income or other child tax credits or whatever, such that then they don't need specifically a housing benefit. But that's not been our approach in the United States from the federal government, certainly, and also our state and local governments, where we really want to think through what are the needs of people, and we attach CalFresh to food needs. We attach, kind of housing choice vouchers to housing needs. But it's absolutely imperative that we support people who are paying, more than 50% of their income as rent as a starting point. And then research is very clear that significant choices, which could potentially lead to harm for families, are made once their incomes once their rents exceed 30% of their income. And I haven't said it, but I'll let my health colleagues say it. It's pretty obvious that healthcare is just a baseline need. And while the social safety net with the Affordable Care Act has really extended that healthcare for the working poor, it's still a patchwork, and we could do a lot better with providing that.
Nadi Lepi?
Yeah, I mean, I definitely agree with all of that. On the healthcare front, we're still seeing people, who, because of one big crisis, can lose everything, right? And so that's just not still an acceptable way to be living, in a country that's supposed to have everything. So I think there's still a lot of work we need to do. I think, there have been some cities who have really experimented with universal basic income. It's one of the things that I think we have, toyed with the idea, just looking to see if we can even try. But, what really becomes precarious, especially for the folks that we're serving, is that if we get above a certain income, for people, who are on their federal benefits, they lose everything. And so, at the risk of losing everything, is it really worth it? So we have to look at a way to structure the current benefits that people already have, maybe even increasing the benefits at the state level, because I know that's something we've all talked about for years and years. The SSI benefit right now is not nearly enough to even go into some type of affordable housing setting without an additional subsidy. So there does have to be some greater overhaul of an entire system, and not so siloed. I feel like we're siloed again because we're doing this overhaul of the Medi-Cal waivers that we're getting. We're running all of them through the managed care plans, which adds an overlay of additional sort of negotiating and having to figure out how we're going to make it work. When we had whole person care, it all came directly to the public entities. It came to the health department. We were able to deploy it as quickly as possible. Now I understand we're supposed to, hold our managed care organizations accountable and have them be part of the solution, but having to navigate each little bit of all of this doesn't really give you an overall solution to everything that we need, right? There's still a lot of limitations. So I think there's still a lot of work we can do.
so just jumping from the one set of silos to another silo, which is the population that is completely excluded or ignored or whatever it might be by the system. I think many of the people on this call will be aware that the number of deaths on the streets of Los Angeles County have been rising inexorably, and that increased in 2020, even though COVID-19 fatalities were not as high as expected, right? But the deaths due to other causes, including substance use, but many of them, the biggest category was unattributed. These deaths have been rising. A study based on deaths occurring between 2016 and 2019 found that of those who died, only 21% they did a study of all the people who died, could they be found in various county systems. We know that LA County has this database of everything, the Info Hub, and only 20% of those who died on the streets were in HMIS. Now, a larger number were in DHS or DMH systems or other systems, but what are the populations that concern you all in terms of exclusion? How do we get to a better place on reaching everybody, at least at some point? And I guess as a kind of follow-up to that, does this sudden burst of mobile clinics that are being talked about as parading through the streets of LA, including from our own UCLA health system, a number of other healthcare providers, what role do they play in this effort?
Should I start? Okay. So that is a population that we're incredibly worried about. We know if they're not in our housing, if they're not in any of our programs, we do need to have a more concerted effort with our street-based teams. We've just at DHS alone, we fund over 80 teams, and our partners at the LA Homeless Services Authority also have street-based teams, and they all sort of mingle and coordinate their efforts. Now, if we're still not reaching them based on that, I guess I wonder, where are these folks, or are they really that hidden? Because I feel like as far as the last 3 years, we've really coordinated our efforts to be able to get to every corner of Los Angeles County and under the bridges, under the, at every encampment. In fact, we spearheaded a COVID-19 vaccination push where we've provided over 12,000 people their vaccines, in encampments and all these different locations, especially in Skid Row. So I do think we need to think about how are we as a system going to be able to coordinate better or fund that better so that everybody can be reached. Now, if they're not in the encampments and they're not, street-based, that to me would be a concern to figure out how we would be able to find them. Are they people that are housed that are coming out onto the streets? What I'm finding, at least in the permanent housing side of our program, is that we're finding a lot of overdose and opioid deaths month over month. And sometimes they are found on the streets because they're using not in their homes, but outside. And then, that becomes a whole other issue that we're going to have to deal with. So I don't really have an answer for that, but I do know that that's an incredible problem that we're facing right now.
Cool. Well, I think we're running out of time. Thank you. I know we covered so much ground. There's really so much that there are so many different facets to this issue, both the challenge of addressing homelessness as well as figuring out the systems. I am very hopeful that our final panel, including a number of wonderful people that I work with, like Melissa Chinchilla and Michael Rodriguez, that they will be able to kind of put a bow on all of this and solve this all. But I know for now, we have a really exciting presentation by Assembly Member Brian. So I'll pass it back to Ninez. Thank you all.
Thank you so much, Randall.
Cheers
Thank you
to
to
the
all the panelists for getting us into the weeds of what needs to get done. Assemblymember Isaac Bryan, thank you for being here. I'm going to first pass the baton, though, to my colleague, Professor Mark Peterson from the Luskin School of Public Affairs at UCLA, who wants to do the honors of introducing you. Mark, also he's in our planning committee.
Thank you, Ninez, and hello, everyone, and great to see you, Assembly Member. I don't know what happened to my background there. because the background's supposed to be what is well recognized by the assembly member, but it disappeared. Sorry about that. It's my great pleasure to introduce you, Assemblymember Isaac Bryan, who, for all who don't know, represents District 54 in the State Assembly, which stretches from our own Westwood and UCLA and Culver City, across the city to Century City, Ladera Heights, Mar Vista, and parts of South Central and Inglewood, and a lot of neighborhoods in between. We are particularly excited to have Assemblymember Bryan speak today, not just as our representative, but because he brings together his own life experience, tremendous passion, and frankly, analytical depth to the central challenges facing our communities in the state. He's a graduate of our Masters of Public Policy program here at the UCLA Luskin School of Public Affairs, where I can tell you he thrived and quickly revealed his natural leadership abilities. Prior to joining the legislature, he was an energetic and effective community activist on all kinds of issues, including racial justice and criminal justice reform. Although he was elected to the State Assembly just this past May of this year, he is already recognized as a rising star within the legislature. More details are available in the bio in the chat, in his bio in the chat. So let's move right on to Assemblymember Bryan. The floor is yours.
Professor Peterson, thank you for that introduction. It's incredibly kind and always good to see you. For those of you who don't know, Professor Peterson actually recruited me to the Luskin School of Public Affairs. He was chair at the time that I entered the department. So it's good to see you. I also see a good friend, Suzette Shaw, in the chat. So always good to see you, Suzette. Today's topic is incredibly important. It's been timely for too long now. What we're witnessing is decades of failed policy, from exclusionary zoning to redlining to income disparities to overinvestments in systems of harm and subjugation instead of systems of care and opportunity, to economic stagnation for some. At the same time, our state is booming. That's one of the things that hit me so heavy joining the legislature this year. As I was told by a number of my colleagues, I would never have a year like this again. With a record budget, $270+ billion. I had a recent conversation with former Speaker, now Congresswoman Karen Bass. Back when she was Speaker of the Assembly, the budget in California was $80 billion. And so to have nearly a $75 billion surplus this year, it was something unprecedented, and it put an urgency in me and a number of my colleagues, including the governor, to make investments in the things that really, really matter. And housing our houseless neighbors, I think, is high on all of our priority lists. As Professor Peterson mentioned, this issue is personal for me. I think it's personal for all of us at this point. But for me, I can remember a number of instances graduating from the Luskin School of Public Affairs. I remembered graduation day, I couldn't afford to pay my rent. And one of my mentors, another professor at UCLA, actually wrote me a personal check to make sure I stayed housed until I got my first job out of graduate school. My younger brother has been houseless since he was about 16 years old. He's a crossover youth from the foster care system to the juvenile legal system. I have an older brother who's unhoused in Sacramento right now, who I see whenever I go up there. And the cross intersection between behavioral health and mental health needs is exacerbated when you spend significant time on the streets. And so there are many people who didn't suffer from mental ailments or behavioral ailments until they became houseless for an extended period of time. And that's where the schizophrenia kicks in. That's where the other things kick in, because you're detached from the social constructs of the society that we all live in a daily basis. So in thinking about what the problem is, it's one of the things that I learned in graduate school. Professor Michael Stoll, who now runs the Black Policy Project at UCLA, how you define the problem has a lot to do with what kind of solutions are available. If the problem is just there are too many people on our streets, then any solution that gets people off of our streets, including incarceration in the county jail, is a potential solution, right? If the problem is more nuanced than that, and I believe that it is, the problem is that wages have stayed stagnant while housing costs and costs of living in Los Angeles have increased. The problem is that we've had a lack of production of new housing in Los Angeles with a rise of our population. The problem is anti-Blackness in a city and a county where 8% of the population is Black, but over 40% of the population, or the unhoused population, is Black. There's a serious racial reckoning that we have to come to grips with. The problem is that we've invested significant investments in systems of harm and subjugation that we've used to try to curtail this problem, not fully recognizing that they often exacerbate the root causes of these conditions. And I'll go more into that. When I was at UCLA, when I came back to work at UCLA, I helped build up a project called $1 Million Hoods with Dr. Kelly Lotto Hernandez. And one of the first things we looked at was arrests by the Los Angeles Police Department and the Los Angeles Sheriff's Department. And what we found was over a decade-long discovery that every year the number of unhoused people arrested by the Los Angeles Police Department went up. At the same time, every year the number of total arrests for everybody else went down. That was staggering. The most recent numbers I saw indicated that over 22% of all LAPD arrests were people who were unhoused. So the next thing we did was to look at the top charges. What are the reasons why we're arresting folks who are unhoused? Is it really public safety concerns, or has it become part of our strategy to address this problem? And what we found was the number one reason for an arrest was a failure to appear for a previous citation. It got to the point where Chief Moore had recommended that we clear the failure to appear backlog for people who are unhoused. Now, we haven't fully finished on that policy, but what I know is that the average time spent in the county jail was 6 days. So we would cycle people through the county jail at a daily bed rate cost, both for the city and for the county, and then put them right back on the streets. And some folks in that period of time, they lost the car they were sleeping in, towed, gone. They lost the home that they were building up. They lost the job opportunities that were on the table. And they've been stigmatized and traumatized by being touched by the criminal legal system, which by and large just increases the likelihood that you have future contact with the criminal legal system. So that's one component of this that we have to be completely mindful. The other is that we just don't have enough housing or affordable housing, from shelter space to transitional housing to permanent supportive housing. And how we deal with that is something that I've been grappling with for a long time right now, because when I worked in City Hall with Mayor Garcetti, I worked in the CENTCOM unit where we were looking at a unified homeless response strategy. And we started to build up the bridge home shelters. And what I realized quickly is that some of these projects were going for $500,000 a unit. And it blew my mind, because I would sit and think to myself, and I still do, if I had $500,000 in cash and I wanted to help someone who was unhoused, there's a whole lot of good I could do with that. I could buy you years of stay at the W Hotel and put a high interest yield savings account up for you, and so on and so forth. So are we spending our public dollars in the most efficacious way? Are we getting the desired results that we want from it? And at the same time, it's a long and arduous process to get things built in Los Angeles. And so we've got a lot that we've got to process and think about. But to that extent, in the places where we have land and we have the willingness of the surrounding community to build, we should build. And one of those places in my district is the VA. There are 4,000 unhoused veterans in Los Angeles. And on the VA, we've got a project that's proposed to build over 1,600 units. But again, the time it takes to build those units, it's about a decade-long plan. This year, I brought in $20 million out of the state budget to help finish up the first 200 units, which will go live next summer. But in the meantime, our numbers of folks who are unhoused continue to grow. For every 10 people we get off the streets, 11 people fall into homelessness. And so we have to have a very serious conversation about wages in a state where we've had the fight for 15 for so long that we forgot that $30,000 a year is no longer enough to live in California, and certainly not in Los Angeles. And so we have to think long and hard about that. One of the solutions, a temporary solution or an attempt at a solution, a pilot solution that was proposed and passed in the legislature, was a homeless tax credit for businesses willing to hire folks who are unhoused. And I was a part of that coalition, and we did a press release at Hot and Cool Cafe. But I'm not fully satisfied, because what we offered as a state is that we would pay a $17 an hour salary for any businesses that were willing to hire folks who are unhoused. The tricky part about that is that that's still not going to be enough to help you really rebuild your life. And so we have to think about our public investments. I'm glad that this year we have a historic $12 billion investment at the state level, largely architected by Governor Newsom, but led in no small part by those of us in the legislature, to make sure that we get that money directly to cities and counties to get ready-made projects up, to build the wraparound services that we need, and to keep on pushing. To tie this back to the point about incarceration I made earlier, when we passed the historic ballot and bond measures here in Los Angeles, HHH and Measure H. HHH at the city level allocates about $1.2 billion over 10 years to homelessness. And again, to my training at the Luskin School of Public Affairs with discounting and net present value, we know that 1.2 billion over 10 years is a lot less than 1.2 billion right now. And that 100 million each year that gets allocated is going to decrease in purchasing power every single year. Contrast that, for example, with the budget we spend on the Los Angeles Police Department, which is 1.8 billion every single year. And I think that's where some of the calls to look at our investments in systems of harm versus systems of care. Do we really want to solve homelessness if we're investing 10 times as much in the primary agency or an agency who has 1 in 5 of their arrests being somebody who is unhoused on the streets? Or should we think more creatively about those dollars? And that's just at the city level, right? One of the other problems that we have in California is, in addition to building, we're not thinking enough about other innovative models. So one thing that I've been exploring recently with a number of community-based services and nonprofits here in my district is shared supportive housing. We have a 20% vacancy rate on single-family homes even. And I saw a model that was pretty profound. It was an organization that had 50 homes that they had found a way to get unhoused persons on the streets who are living with SSI or some form of income, not nearly enough to live on, $1,000 a month, $500 a month, but they would pair them together into a shared living model in a neighborhood that was mixed. You wouldn't even know that your neighbors were previously unhoused. And in that model, there would be services provided. The landlords would provide the basic utilities and some of the groceries so that people could get into the idea of paying bills again. But to start out with just a single payment, the nonprofit itself would never touch any of this money. They would just facilitate the relationship. And I thought that that was incredibly profound. They were housing hundreds of people every few months due to this kind of a model. And so I was thinking, I've been thinking for a while now, I don't have an answer, but how can the state get involved in encouraging that kind of rapid response, which is significantly faster than building new housing, although we still need to build new housing. There was a big fight in the legislature this year, as there is every year, about our zoning and what does it mean to build new housing. And regardless of where you stand on it, SB 8, 9, and 10 have passed. And so there are some tools and conversations about building more multifamily units and the idea that a greater supply stock will decrease the price of rent. But I don't think that in this entire conversation, we had a real clear focus on what this means for folks who live on the streets, right? I largely have taken our housing conversation to think about yuppies like me. I'm one of 2 renters in the state legislature, and I live with my partner and our Great Dane, but also our best friends who are a young married couple. We all share a house because that's what the cost of living like is in California. And so as we're talking about building new housing, in some of the counter arguments, there was this question about affordability. And I think to some degree that was to disrupt the idea of producing any new housing, but we still have to have that deep conversation about tenants' rights, about tenant protections, about keeping folks housed. Because as I mentioned earlier, for every 10 we get off the street, 11 fall in. And part of that 11 falling in is losing the housing that they currently have. And so that's going to be something that's got to be high on the priority list in the legislature this next year. One of the things that I passed this year, in fact, my first bill was AB 1043, which establishes a new category in our housing law, acute poverty, which is folks who fall into 0 to 15% of an area's median income. In LA County, that's 180,000 households, and it's $17,000 a year that they live on. And because this new category has been codified in state law, the governor signed it just last week. If the state puts up money to build affordable housing, and we require that a number of units fall into the acute poverty index, then you can't charge a rent that's beyond 30% of that income. And I think that that's going to help a lot of folks stay into their homes. And I think any projects that the state puts money towards building should have requirements for affordable units across a range of different deviations from an area's median income, so we can keep folks housed. There was also 27 other housing bills that the governor signed just the other day, and over 30 housing bills that made it out of the legislature and onto his desk. And so we're fighting very hard We're looking at this from a nuanced approach and from an intersectional approach. That includes looking at the impacts on communities of color, looking at the impacts on women. I'm particularly vested in looking at the impacts of foster youth, particularly youth who are transitioning out. We know that within 1 year of aging out of our child welfare system, 40% of youth are unhoused. And so finding ways to mitigate that risk and stop that trajectory early is incredibly important. And so in this particular moment, I think we need to look at multi-level solutions. There was one piece of policy I was a little frustrated, didn't make it out of the legislature, and that was a centralized agency for LA County, an affordable housing agency. It was proposed by Senator Sidney Kamlager, my counterpart in the Senate, and she fought long and hard for that bill. I think it was going to be a way for us to allocate resources in a controlled and thoughtful manner and distribute them with a regional focus. Because right now, to do any kind of an affordable housing project, if you look at the spreadsheet of where the funding comes and where the relationships have to lie, there are about 10 different components from HHH, state money, private money, federal money. And by the time you've got it all set up, if any one piece of that falls through, a project falls through. And so we've got to do a better way of centralizing resources to address our regional needs. And so I was sad to see that bill not make it this last year. But those kinds of ideas that are being spurned by community, by experts like many of you, are giving us a lot to think about in the legislature. And I'm grateful that Governor Newsom was not recalled, because I think this is an issue that he's taken from being an important issue in California to a very central issue, if not the #1 issue on the docket. And so over the next few years, I think there's a lot of good we can do. But I don't think we really have a choice, right? We have to do good, because we didn't do a pig count this last year because of the pandemic. But I suspect that the number of folks who are unhoused has jumped pretty significantly. And the reason is for the same reasons that we have such a large unhoused population to begin with. All of the social fabrics in our society that keep people from falling through have been impacted to a significant degree because of the pandemic. And the eviction moratorium has expired for the state of California. And a number of folks have been unable to find work, or the work that's being offered now doesn't meet, the wages don't meet the needs that you need to live. And so there's a large disconnect that I think we're going to have to address, not just next year, but the next several years to come.
Well, thank you very much, Assemblymember Bryan. That was incredibly illuminating and gives us all, I think, a degree of confidence that our elected officials, particularly you, have your hands around this very complicated issue and have the means, the wherewithal, the moral passion to move this along. If we had more time with you, I'm sure there'd be many questions. I'd want to ask you about how optimistic one can be moving forward at this particular moment, now that the issue is front and center in California. But I know you've got a hard stop on your time today. So again, thank you very much for joining us.
Well, Professor Peterson, in terms of my optimism, I'm naively optimistic about this and a number of issues. I believe in California, and I believe in us. And I also believe in the think tank power of incredible scholars like yourself who do this work day in and day out to help provide us with the data and research that we need. So I'm hopeful, I'm optimistic, and I'm not going to stop fighting, that's for sure.
Great. Thank you very much.
Thank you very much, Assemblymember Bryan. Thank you, Mark Peterson. We are putting together a policy piece of the insights that we've heard from the multi-level perspectives that you noted, Assemblymember Bryan, that I hope will be presented to you and your colleagues, so you'll have more people in the room like you that can pass the initiatives that you had just mentioned. So thank you so much. There were some questions, but we're going to move on with the program, honoring your hard stop. The next part of this program is going to be on reflections on our 2 days of conversations. And I'd like to make sure that everyone is in the room who will be, okay, so Melissa Chinchilla, Michael Rodriguez, Garen Corbett, and Mark Peterson. Please put your cameras on so people can see you. Thank you. And this will be about 20 minutes of reflections on the conversations, any new insights, any takeaways something that struck you or that you thought could help us move forward. So I'm going to start with a colleague, Melissa Chinchilla, who is an expert actually has been working on looking at housing insecurity, homelessness, particularly in LA, but also broadly nationally in the Latinx population. And Melissa has I think a unique perspective of being in the planning space, but also having worked for the VA and now currently works at Altamed. So works as a research scientist there in the Altamed Institute for Health Equity. I've also been very privileged to write a few papers with Melissa. So Melissa, we'll start with you, and then let me just tee up the others so they know when they're on. Then we'll go with Garen, then Mike, then Mark.
Okay, great. Thank you so much for that introduction, Dr. Ponce. Really appreciate it, and also really appreciate being part of this panel today. So a lot's been said, and there's a lot to reflect on. I think these past 2 days have been filled with great ideas and commentary on some of what's happening today, and not only nationally, but locally as well. But that said, there are two major themes from the past 2 days that I'd really like to take a moment to reflect on. The first is the importance of recognizing that our systems are interconnected and that solutions to homelessness need to work across sectors to streamline and really maximize resources. So this interconnectedness and the opportunity to work collaboratively is increasingly being seen in our healthcare system, where there is a growing recognition that social needs such as housing are central to individual health and well-being. On day one of the symposium, Dr. Margot Cushell noted that integrating healthcare and homeless services will require partnerships that recognize opportunities for mutual aid and that also eliminate silos. And this reminded me of a conversation that I had with a colleague that was working with homeless service providers in the Los Angeles area. I remember asking her what she thought would motivate greater partnerships between our homeless services system and healthcare. And she was quick to note that service providers are already overwhelmed with clients, so additional referrals were not something that providers were necessarily looking for. But what could drive partnerships would be to increase resource contributions that were being put on the table by healthcare. And this is why I think changes in Medicaid reimbursement, which are increasingly funding social needs, and a move to managed care, which is leading healthcare providers to recognize that it is to their economic advantage to be responsive to patients' social needs, are very exciting. Changes to Medicaid, including some of what is being proposed in California under CalAIM, have the potential to transform the way that we think about and address health. However, as Lipi noted today, there is still much work that needs to be done in this area, and we need to really figure out how CalAIM is going to be rolled out locally and how we could really make it a benefit to our healthcare and homeless services. At the intersection of health and homelessness, there are also a number of topics that I have been incredibly interested in and which I believe are important for us to pay attention in the near future. One is, how do we ensure that healthcare providers have the competence to serve individuals that are facing housing instability? So in other words, how do we provide appropriate medical care that's tailored to individuals experiencing homelessness? And this includes paying greater attention to meeting people where they are, such as the role of street medicine. The second thing I'd like to highlight is the question of who is a healthcare system identifying and connecting to homeless services. Community health clinics, for example, often play an important role as trusted institutions locally, and it is important to explore the role of these local healthcare providers and possibly helping identify individuals that would otherwise remain service disconnected. We've spoken a lot about reaching folks that are not connected to mainstream homeless services, and I think healthcare could possibly provide an opportunity to do so. We also need to consider the healthcare system's ability to identify emerging needs through screening tools and to also intervene at critical times to assist in prevention, another thing that's come up in conversation throughout these last 2 days. Lastly, we should also pay attention to emerging opportunities to integrate our homeless and healthcare data systems to provide better care for individuals that have high healthcare needs. Data integration will present an opportunity to more efficiently and cost effectively serve high needs populations through continuity of care, and will also help us understand how individuals are interacting with both systems. So as a researcher, I get very excited about data integration, and I think there's lots of opportunity to learn as we integrate some of these systems. And then in addition to these thoughts at the intersection of health and homelessness, I want to recognize another theme that really has resonated with me, and that's the importance of understanding people in context. So this includes recognizing the economic, social, and historical context that makes families and individuals vulnerable to housing instability, and paying greater attention to racial and ethnic disparities that make some of our communities more susceptible to experiencing homelessness. It also means that we need to create a system that can respond to the unique experience and needs of every individual. Along these lines, we need to identify how current policies and programs may actually be detrimental to the well-being of the people that they are trying to serve. So for example, on day one, it was noted that housing subsidies that require someone to stay in a congregate shelter or on the street in order to be considered eligible for services eliminates other options, such as staying temporarily housed with family, and that's really problematic. Lastly, I believe that we need to do a better job at recognizing the range of experiences that individuals have with housing instability and homelessness. Our current definitions of homelessness do not account for individuals that may be living in substandard and overcrowded housing, or someone who is couch surfing. So when we think about preventing individuals from entering the shelter system or ending up living on the streets, we need to consider the range of precarious housing and identify opportunities at intervention on the front end. So to conclude, I want to go ahead and thank Dr. Ninez Ponce and her team for putting together this symposium, which has, I think, undoubtedly given us all the opportunity to reflect on what we are doing or could be doing to address one of the most pressing challenges of our time. So thank you very much.
Thank you so much, Dr. Chinchilla. And I think you've already started our policy. We haven't really figured out what to call it. We don't want to call it a white paper, but a policy action report. But it's you've gotten this started. It shows in your commitment, in your scholarship, and your collaboration, wafting in the disciplines of silos and academics, from urban planning to public policy and for public health. So I wanted to thank you, and the space of solving the problem of the unhoused, I think, is in good hands with your voice. So I wanted to thank you and for being here today. I'd like to go next to another colleague who is I've also worked with for several years and is part of the planning committee, Mr. Garen Corbett. Garen, you're up. And Karen's, I think, is based at Berkeley, but runs a multi-campus, UC campus project where we actually show, the professors show utility to the state legislature by, so we're not just writing papers that sit on the shelf and don't get read till, many years later, but really use their experience, their expertise, their brain power to provide guidance on to legislators on the utility, the value of benefit mandates. So I wanted to ask Garen for, I know you're at, there's a bridge behind you and you're from Northern California. I know you go to Sacramento a lot. Help us, what did you think about the proceedings and also what, researchers, activists, agitators alike can do moving forward?
Sure, thank you, Ninez. That was a terrific introduction of my program. I'll have
Is it accurate?
have to have you take that one on the road. And thank you, Melissa, for your excellent comments. My first job out of college was at the VA, and I 25 years later still think of many of the veterans that I met in my time there. So as Ninez said, in my day job, My colleagues and I provide the legislature with independent and objective analysis. This unique program is called the California Health Benefits Review Program. And we take a multidisciplinary lens, which is, of course, I think very relevant to our conversations these past 2 days, and draw from all available evidence to elevate the policymaking process by drawing upon the expertise present at both the University of California and beyond, and remaining impartial and neutral. The scale and scope of the issues that have been so powerfully described in this symposium, frankly, they defy any well-intended individual piece of legislation where solutions might be mustered in one piece of legislation. There is no easy fix. The issues we have covered over these past 2 days require a much more robust, multifaceted, and frankly, sustained effort by everyone. It requires engagement, healing, resources, social change, leadership, and commitment across our society. But of course, this needs to start in every single community and neighborhood. From my own observations over, and sadly, it's now 25 years, time flies, as a student of policy engaged mostly at the state, but as well as the federal levels, I believe that there are short-term, medium-term, and long-term efforts to pursue concurrently that over time will hopefully accelerate and build momentum for each to become sustaining and lasting. Confidence-building measures are necessary to get partners together, working together, building trust, foster collaboration, and generate the kinds of political and public support that are essential to moving forward in many of the campaigns and efforts that we've heard about these past 2 days. Now, alas, our system of government is not especially well set up for this kind of large-scale change, but we do have experience to draw from. The aspirations for offering healthcare for all, while they have not all been, of course, achieved, much progress has been made. And so I think we have some lessons to draw from healthcare. And of course, one cannot have healthcare for all if we have people without dignity and housing for all. Now, evidence development isn't just about cataloging what worked where, but a process, of course, that requires constant refinement, adaptation, and trial and error. Implementation, as Mayor Schaaf noted, is absolutely critical. And Randall Kuhn noted, we learned something from every case study. I agree. We have to invest as many resources, expend as much energy, study not only the policies, but the implementation process of each initiative at the local, state, and federal levels. We simply have to better meet people where they are and empower them and programs that are helping people to stay housed, stabilize, to truly meet those needs. And of course, we need to build more housing. We need to build the airplane as we fly it. States and the federal government have systemic issues to work on and much needed resources and technical assistance to provide. But as we have learned, more flexibility and support for local initiatives is critical if we are ever going to meet individual needs. So I would say, to close at a personal level, I am deeply moved by the passion, commitment, and expertise by our panelists. I think Rick Brown would be proud of all of the areas of evidence that we brought into this conversation. Endeavors like this, I think, are absolutely critical building blocks to successfully moving forward. Thanks so much for having me.
Thank you so much, Garen. And it is a building block. This is a start. And we don't have the answers. I just take note, all the audience who have posted questions, we are keeping them. We didn't get a chance to answer. And in some cases, we don't have an answer yet, but we are memorializing them, keeping them, and incorporating them in this policy report that we will be developing. So I'd like to introduce another member of the Planning Committee, Dr. Michael Rodriguez. Michael is a longtime colleague, and it turned out we were in college at the same time, but we never knew each other at the same time. But Michael is such a champion of health equity, both in the United States and globally, and always in our planning committees, always comes up with the moral argument of what are we doing? Why are we doing this? And so I just wanted to have Michael, give some of his reflections on the last 2 days, and whatever perspective you'd like, from a medical perspective, from a public health perspective, from a health equity perspective, or all three.
Well, thank you, Ninez. I'm thankful and inspired by the many, many excellent speakers that we've had, and also acknowledge Melissa and Garen for their excellent report comments that have just preceded me, and then really reflect on how many of these speakers have underscored the understanding of the problem that we're facing, as well as shared many pearls of wisdom. And so I'm just going to reflect on some of those. One of these understandings are related to how the historical and current policies, fueled by discrimination and a growing wealth gap, among other factors, have unjustly fueled the complex connection between housing and ill health. Besides access to quality housing, these policies also impact and impair safety, as well as access to transportation, healthy foods, education, and good jobs. It was emphasized how limited access to quality housing is felt most by those in communities that have been historically discriminated against, whether they be American Indians, Latinos, immigrants, disabled, African Americans, or several other groups, underscoring the importance for keeping an equity lens as we look at this issue. The speakers have wisely recommended moving with responses informed by authentic inclusion and community engagement of those with lived experiences, whether engaging with federal, state, and local sectors in government, nonprofit, and private areas, to keep doors open to each other and work together to strengthen the trust in our institutions and organizations. Aligned collaboration between these stakeholders, as Melissa pointed out, will help strengthen federal, state, and local policies that address housing, while ensuring that this equity lens focuses on removing those discriminatory policies and structural barriers that still exist, helping to ensure that those who are most vulnerable are always prioritized. While additional services are certainly needed in many communities, speakers have pointed out the dire need for coordination between the various stakeholders involved with housing and housing-related issues. So those focused on housing are working with these other sectors, be they public health, medicine, transportation, employers, public as well as private sectors. Access to quality housing is a human right. And we have a moral obligation to actively collaborate to implement and shape housing responses through programs and policies that can inspire us and others to take action and advance quality housing in order to maximize health equity and well-being for all. It has been a great pleasure to be with you these 2 days, and I look forward to moving forward for action. Thank you.
Thank you so much, Michael. And I'd like to introduce again my colleague, Mark Peterson. In addition to having the bragging rights of recruiting Assembly Member Brian to the Luskin School of Public Affairs, Mark is, again, a wonderful colleague, long-term colleague, is nationally renowned in his insights on federal healthcare reform, particularly on Medicare, but also on kind of the reaches of public policy and the jurisdictional, as we heard, tensions that we heard, especially in that we heard maybe what's stopping some of the solutions. So wanted to ask Mark to give his closing remarks and his insights on the 2 days.
Thank you very much, Ninez. And first, I just want to echo everything that my colleagues on this panel have stated. Just a great deal of thoughtful observation about what we heard over the last 2 days. Also want to say how much a privilege it's been to be working with everybody on the planning committee and everybody at the Center for Health Policy Research on this symposium. I think we can go back and say it did what we hoped it would do. And I'm very pleased about that. I'm going to end with a more positive note, but I also want to start with a real concern. And that is, I am a political scientist. I'm a student of American politics and political institutions. And as any one of my colleagues across the country would say on these issues, the United States is perhaps the most fragmented system of governance, the most fragmented system of political institutions. And to some extent, that can be a source of innovation. We heard that in this symposium. We heard about Oakland and about Nashville and about Boston and about the VA and about the activism of youth being brought into this issue of homelessness. And so there are ways in which this fragmentation, this federal system allows for ideas to be tried, to be tested, to be sorted through, and to be brought to the fore, and to really inform the kind of symposium that we've had these last 2 days, and we heard about in particular yesterday. But that fragmentation is also the great big wall that just keeps blocking the major kinds of actions that we need to see to really address the issue of homelessness, our neighbors who are unhoused, and all the complexities that are involved with that. And one of the real problems is no matter how much money flows from Washington, D.C., no matter how many dollars descend across the state from Sacramento, ultimately the action is going to have to happen effectively on the ground in local communities. And there I worry, because certainly all of us who've been paying attention to how the public has been responding to the increasing numbers of people living on the streets and where they're living and how they're living, is we have a lot of people at the local level who simply want the problem off of their streets, but they don't want any of the solutions in their neighborhoods. And that's a contradiction that somehow we're going to have to figure out and resolve. And I'm not sure, despite the brilliance and the experiences and the just range of expertise that our incredible speakers brought to the symposium, that anyone really has figured out how to solve that part of the problem. But here's where I want to be a little optimistic and kind of go back to Isaac Bryan and his optimism. And that is another thing we talk a lot about in political science are windows of opportunity and what creates them. We are in a different moment right now in California. This was captured on Friday in the editorial by the LA Times, kind of summarizing the governor's commitment, the massive flow of greater dollars in these next 2 years, and a variety of ways in which there are other initiatives as well from the legislature that could really move this issue. And then we get shown to us by our speakers and those of us, those who are elected officials, and ending with Isaac Bryan, we have people in government who know this issue inside and out, who have great understanding of the complexities and nuances, who are connected to the research community, the activist community, and the advocates in general, in all different kinds of dimensions on this issue. And so what I do want to end on is maybe we are at that moment, as reflected in the symposium, reflected in the consensus around a number of interventions that we know work and can be effective, and this rising set of attention and the amount of resources being put into place and the kinds of talents we have in government and from the local level and the county of LA, for instance, all the way up through the governorship. Maybe this is the moment in which there's a real window of opportunity to tear down that wall that has made it so difficult in this fragmented system to be able to achieve the kinds of change that we can. It reminds me a little bit of a moment for me with Rick Brown many years ago. He and I had been working on healthcare reform in our own ways for many, many different years. I met him when I was working in the Senate on the healthcare reform bill for Senator Tom Daschle, and he was helping to advise Senator Bob Kerrey. And it was a 100-year struggle to get to anything that represented meaningful healthcare reform. When the Affordable Care Act passed finally in 2010, Rick contacted me and said, let's have a party. Let's come together and at least celebrate this advance that we've had with the Affordable Care Act. And we were able to toast champagne, not thinking that this was the be-all end-all of solving, getting to universal coverage and equitable, morally consistent healthcare access for everyone, but it was a huge step forward. Let's hope that the center can sponsor that kind of party, not too far in the distant future, when we're able to do the same thing about having moved the ball forward on getting at least a big chunk of the issue solved for the problem of homelessness in the state of California. Thank you.
That was optimistic. Thank you. But we have to seize the moment. Thank you so much, Mark, Michael, Garen, and Melissa. I also thank all of the panelists today and the panelists yesterday, the discussants, the thoughtfulness that was put in assembling the program. Thank you, Planning Committee. I am beholden to Mary Brown, who I hope is still on, to thank you so much for sharing Rick with us to the world, and to continue his legacy and support for the Center for Health Policy Research and for sponsoring the E.R. Brown Symposium. I wanted to thank the California Health Benefits Review Program, headed by Garen, Cedars-Sinai, and the Melville Charitable Trust for their sponsorship. I also wanted to thank the enduring support of the California Initiative for Health Equity and Action, led by Professor Hector Rodriguez at UC Berkeley. He lent us Tasia, who you can't see, but was also in the Planning Committee. The Fielding School of Public Health, it's our home, and I'm glad that I have such wonderful colleagues such as Vandal Kuhn and Michael Rodriguez in the Fielding School of Public Health. To the Ziman Center for Real Estate, which is based out of the Anderson School of Business, and to the Luskin School of Public Affairs for lending us the wisdom of Mark Peterson, and for training the wonderful MPPs that are out there, and as well as MPPs, MPHs. So speaking of MPPs and MPHs, we have a student session that is coming up right after. I believe Tiffany has put at the top of the hour, sorry, not right after, you can take a break. But not too long. And at noon Pacific Standard Time, we will be convening, and we will be featuring the marvelous poet Suzette Shaw. And it is open to all students, regardless of which school, regardless of what program you're at, whether you're K to postdoc